right, we're gonna walk through a couple case studies for PRP joints. My probably top two favorite patients. Actually, first patient came in with 3 herniated discs, SI joint pain bilaterally, and he came in and could barely get on the exam table, and he can barely like flex forward or bend back. Couldn't touch his toes. Wasn't sleeping well at all. He was just in chronic pain. He was probably like a 12 out of 10 pain. And we really walked through it all, and saw the imaging, went to the MRIs, saw the herniated disc, and we really dove into like, hey, I don't know if PRP is going to be the perfect answer, but I think stem cells is going to be the route. So we did stem cell therapies on his back, and it was probably the longest treatment that I've ever taken. It was like an hour and a half treatment. Dr. Zan, my associate doctor, was there assisting with that patient, and it was his first time, watching a low back treatment with stem cells. And the patient just had so much trauma to the low back that he had to get an Uber driver or Lyft driver to kind of drive him out of the clinic. And Dr. Zan was like, Dr. Fan, is he going to be okay? And with that, I've seen a lot of patients limp out of my clinic, and in the beginning of my practice, I was like, is this really going to work? And I was really not a believer in the beginning of my practice because, spitting down in a centrifuge blood, taking out the platelet-rich plasma and injecting it back in, and it's supposed to miraculously get patients out of pain. And with this one, I was like, Dr. Zan, I really don't know. So I had a 1-week follow-up with him the following week, and the patient strolled through my door, and I said, what's up, champ? And he's like, Dr. Finn, I don't know what you did, but my back is 90% better. So 7 days, came back in, and strolled through the door, 90% out of pain. I was like, can you touch your toes? Went all the way down, touched his toes, a little bit limber, and he's coming back up, but night and day difference. And Dr. Zan was there as well, and Dr. Zan's mouth was just dropped. Like, how did that happen? So after about 3 months, we did a second round treatment because we wanted to increase his range of motion, his functionality of the low back. He was 90% out of pain with the first treatment, and with that second treatment, I haven't seen him since. So he gave a great testimonial, so check out his testimonial on YouTube, but that's probably one of my favorite cases. Another one actually is low back pain as well, an 81-year-old female. She came in and she was experiencing a ton of back pain, wasn't able to sit for longer than 5 minutes, 2 herniated discs, a lot of SI dysfunction on bilaterally, and she had spinal stenosis and a lateral recess on the right. So really bad low back, and she was like, Jason, I really want to take photography classes. I'm in a photography class now, and I really want to travel the world and take photos. And I was like, you can't sit for longer than 5 minutes, like we got to get you out of some pain. So for that patient, we did 3 rounds of PRP. I got her maybe like 35-40% out of pain. She came back in, I think it was her 82nd birthday, and she's like, Jason, I'm getting old. I don't really know how much time I got left, but like, let's just get me out of pain. Like, I really want to travel. I'm like, okay. So we did stem cell therapies on her back as well, and 1 treatment in, I saw her back in 3 weeks, and she was like, I'm 95% out of pain. And I just booked a flight, I think, to Egypt or Europe to take photos and travel. And obviously from California all the way out there, probably 18-19 hour, flight travel time. And so we did that injection. She traveled, took photos, came back, showed me all of her, her photo album. And she was like, Jason, you got me out of low back pain, but like, can you just fix all the rest of my joints? When I was walking around, like, my other joints hurt. She had a knee replacement in one knee, but I did bilateral hips, bilateral knees, and bilateral ankles, and I haven't seen her since as well. So those are two of my favorite patients that I got out of, this tremendous amount of pain, low back pain, which is debilitating for a lot of patients. And it was really rewarding because I got into medicine because I tore my ACL, dislocated my kneecap in high school. So with that, that's why I became a doctor, to just help patients get out of pain or help them improve their quality of life. It's really important for me that patients get to live a fulfilling life and live their aspirations and dreams. So those are my two favorite cases for PRP, but if you have any questions, if you have any concerns, if you're experiencing any joint pain, click the link below and read some more information and reach out to my team if you have any questions. Thanks.